Jason asks, how do you recommend optimizing quality scores for ACOs using MIPS CQMs?
Great question, Jason. I think the first thing to remember is we change what we measure. So you need to measure, and you need to track your progress at the right interval. Too infrequently, and you don't have any opportunities to improve. Too frequently, and you have excessive opportunity to meddle or fiddle, and you might say oversteer your system. So I'm inclined to think that for most improvement programs, monthly or quarterly data is probably ideal. Now, daily or weekly can work. A daily or weekly process has a couple of advantages. Daily can turn your quality feedback into gaps in care feed forward. So all that same reporting that generates the quality reports and monitors your quality can be used to improve your care, which is great. But you need to have the discipline not to fiddle with the data if you're looking at it frequently. Use it to recognize crises when they occur. Use it to recognize opportunities to serve. But recognize that random variation is always there. So if you're too responsive to day-to-day changes in your quality measurement, you may take some of the effectiveness out of your quality improvement program. I love time-oriented statistical control charts. Combine that with a disciplined analysis to watch for special cause variation. Then you can keep from overreacting and engage your teams in a great process. Now, not all problems uncovered by your measurement are going to be defects in the quality of care. There's a flow to every care process. There are questions of who does it, where the best data comes from, who collects it, where it's documented. Can you get the data with simple queries out of your system? How easy is it to recover? So you want to start by setting up a measurement system, and I think expect that some of your measurements are going to be empty, going to be way off. But if you need to start to measure sometime, and then try to figure out why, whether it is off and why it's off. So you watch and learn. First you measure, then you audit those measurements, and you don't have to do an enormous audits, 10 looking at 10 patients to compare to their quality scores. Look at the charts, see on your manual audit how they fall, and see if it matches the quality scoring. If you pass those first 10, extend it to 30, and then keep periodically auditing to adjust your workflows, adjust your training, adjust your templates, and then repeat the process. And this is going to be a continuous learning process. And some of my clients have been engaged in this for a decade now. That they continually find the reasons that their templates don't, that their documentation workflows or the templates they're documenting in are not bringing the desirable data into their quality reports. So you'll be improving your system, and that system is made up of people, processes, and technology. And look for ways to put the right people in the right jobs, give them the training they require to do their jobs, adjust the processes, your written or unwritten processes and procedures, and make sure the technology is configured. All technology is flawed, but most of it can be configured to help you do a better job. And recognize I like to watch three general rules for my continuous system improvement. Your aim is to standardize. Try to get everyone in your system doing things in the same way. You want to simplify, reduce steps when you can, make the decisions simpler, remove complexity every opportunity you have, and integrate. You need to make choices that bring your your care into closer collaboration and coordination. Your healthcare system should be operating like a well-tuned machine that you recognize the problems quickly, you move them on quickly when indicated, get them to the right initial treatment when you can be that the end of that chain. Always work on eliminating waste and delays. And get started now. The sooner you start, the sooner you see benefits. It's going to be a competitive process. You want to perform better than your neighbors, and expect it to be continuous. You'll never be done looking for the problems and correcting them.